Okay. So I presume this patient underwent prostatectomy or removal of the prostate because of prostate cancer. So in the follow-up, we usually will check the PSA. Yes, so it's not wrong to say that the PSA is the usual indicator. Once the PSA reaches a certain level, let's say it's increasing, then we may need to do other tests like a PSMA scan and things like that to rule out that the cancer has come back. Okay. If it's an enlargement of the prostate, it shouldn't cause impotence. Okay. In some cases of prostate cancer, if it's quite advanced growing out involving the nerves, there is a small chance that the patient can present to us with erectile dysfunction. Because I've seen patients come to me for ED, and then when I examine, he actually has prostate cancer. But if you're talking about just the enlargement of the prostate, like BPH that we talk about just now, BPH doesn't cause impotence. Okay. Okay. Enlargement of the prostate is something that happens in most men as we grow older. It's all part of aging. The prostate will enlarge. So as we grow older, we have a higher chance of BPH. We also have increased risk of prostate cancer that increases. Of course, if you have a family history of prostate cancer, your risk of prostate cancer will definitely be higher. If your father has it, it's higher. If your brother has it, it's even higher. Talking about food, they find that food that's rich in lycopenes, there is some evidence that it helps to lower the risk of prostate cancer. So food that's high in lycopenes will be things like tomatoes. But of course, we don't encourage you to eat tomatoes only, because if you take too much of the lycopenes, you start to turn a bit orange because of the coloration. So I think in terms of food-wise, just take in moderation. And the important thing to look for will be the urinary symptoms that will suggest as enlarged prostate, and to do your PSA checks during your health screening, because that's one way to pick up prostate cancer. So phimosis, basically what it means is a tight foreskin that cannot be retracted. So phimosis is usually common in young children, because when they are born, sometimes the foreskin has a lot of adhesions. So after the age of 7 to 8, usually the adhesions will start to decrease, and the boy is able to pull back. Of course, there are some men who never pull back their foreskin before. As a result, they may have the phimosis from young. The other possible cause of phimosis will be patients who have slightly tight foreskin with repeated infections, and the skin actually becomes very tight. We see this in diabetics. Diabetic men, sometimes they were able to retract their foreskin, but because of the poor control of the sugars, they have repeated infections. As a result, they actually develop phimosis, whereby they totally cannot pull back. Yeah. Okay. So enlargement of he probably has quite a big prostate, because you can see you're already having symptoms where he wakes up at night to pass urine. Then PSA 14 is relatively high. It's more than 4. The cutoff is usually 4. So although his levels are going up and down, so definitely his prostate is big, we know. He should actually get an MRI to do an MRI, so that we can rule out any prostate cancer. And chances are he will need a biopsy to rule out prostate cancer after the MRI. So like I mentioned just now, in the prostate gland, two things can happen as we grow older. We can have the benign enlargement called BPH. Prostate cancer can also occur in this prostate. However, BPH does not become prostate cancer because it's a different part of the prostate. So if you think of a prostate like an apple, the BPH occurs inside the flesh of the prostate most of the time. the prostate cancer occurs on the skin of the prostate. So it's a different part of the prostate usually. So yeah, it doesn't mean that if you don't treat the BPH properly, it will turn into cancer. Yeah.
Okay, just for there's a second question. Will the condition of enlarged prostate relapse?
Okay, so if you don't do anything to the prostate will just continue to grow until the point where the patient is unable to pass urine. So let's say, for example, if you go for treatment, let's say you start medications, yes. So the alpha blockers will help to relax the muscle up to a certain point where the prostate is too big, then the alpha blocker will not work. The 5-ARI, which is the medicine used to shrink the prostate, it can only work to a certain extent because once the prostate grows faster than how the medicine can shrink it, yes, then the patient will probably need surgery. Let's say the patient goes for surgery. Yes, the prostate will still grow because the prostate is an organ that was not removed. Because we only remove the whole prostate for cancer. So patient with enlarged prostate, after you scrape the prostate, you laser the prostate, it will grow back. Just like if you do urolift, yes, we are not cutting the prostate at all because for these younger patients, we know that the prostate definitely goes back. So we put the urolift there. The patient needs to understand that the symptoms can get worse with time. And so far, urolift has been successful for at least 5 years, where the patient does not take a medication. So as you grow older, if it enlarges in size, they can either repeat the urolift, or they can now start on medications, or if they want to, they can still go for surgery, no problems. Okay. Okay, when we talk about biopsy of the prostate, during the biopsy itself, it doesn't cause the cancer to spread. That's definite, because we use a small needle, and yeah, so biopsy itself is relatively safe. What we worry about will be things like infection and bleeding, not so much the spread of the cancer. The cancer shouldn't spread because you do a biopsy. The guided biopsy usually is not using a CT, we use an MRI. So, like I mentioned in my talk just now, we do the MRI, then we fuse the MRI images to our ultrasound. So it's a real-time ultrasound whereby we can localize the area where we are worried about, and we can do a biopsy. Yes, it's slightly more expensive because of the new technology, but it has helped a lot of patients because we can then target these areas and pick up the cancers that would otherwise be missed if we can't target these areas.
Jangan lupa like dan subscribe.